So the question is there a new mutant COVID-19 strain that is infecting more children? Or is this simply another example of being alarmist? What is the reality? Are we seeing in Singapore and possibly in other countries now a strain that is infecting more children? Remember, Singapore has decided to shut down its schools. There is also rising alarm in this country about protecting children from a possible COVID-19 third wave. How justified are the fears? Milan Sharma reports.
As Singapore decided to shut schools, alarm bells started ringing in Delhi, driven by the fear of a third COVID wave that may infect children more than adults. It is not that the second wave has not infected children. Some cases have even been classified as acute. Pediatric wards too in India have seen their share of gasping patients. But the worst cases of children being infected have come from the American continents. Since the start of the pandemic, in Brazil, 832 children aged 5 and under have died. But there are also accusations of underreporting in Brazil. According to estimates by the University of Sao Paulo, the figure should be 2,200 children under age 5 and about 1,600 of them less than 1 year old. In the United States, with a far larger population than Brazil and a higher overall death toll from COVID-19, 139 children aged 4 and under have died.
Of course, when the case numbers increase in the community, the children are going to get more infected proportionately, and that's what we are seeing so far. And again, more data is awaited on that.
In India, there have been stray incidents of child death due to COVID-19, like the 6-month-old infant which died in a district hospital in Siddharth Nagar, Uttar Pradesh. And experts warn that while compared to the first, the second wave has been bad for children in India, the third could be even deadlier.
Virus has mutated. It is affecting younger and younger population, including younger adult, younger pediatric patients. In some of the patients, they are getting complicated, but most of the patients do have much more symptoms as compared to the last year.
But there are also those experts who say that as of now, there is not much evidence to support the theory that a third wave of COVID might be more dangerous for children.
The new strain, whether it is affecting children to a larger extent or not, that needs more study, because the data what we have regarding the new strain affecting children are very less. But there are speculation that the new strain or the third wave can affect children more with more severe symptoms.
While there isn't enough concrete evidence to say that the pandemic or COVID-19 second wave is leading to death in children, but the government has agreed to the fact that children are as much affected as adults are in the second wave of COVID-19. And while Western countries have already started vaccination for little ones, the political parties in India as well as the Indian government needs to understand where their priorities lie before India is hit by an impending third wave infecting more children in the future. Milan Sharma for India Today.
Let's raise then the big questions on an issue that concerns each and every one of us. Will this third wave hit children the most, as some are arguing? Is this alert alarmist or is it timely? Will we have a vaccine for kids, and if so, how soon? Just some of the questions I want to raise. Dr. Amit Gupta, Clinical Director, Newborn Services at Oxford University, joins us. From Oxford joins us. Dr. Rahul Nagpal, Director, Pediatrics at Fortis Hospital is with us. Dr. Spurti Arun, Internal Medicine Physician is with us. I appreciate all of you joining us. I want to come to you, Dr. Gupta, there, because we are getting conflicting reports. Is there a new variant or a new mutant out there which is affecting children, Singapore being the first example? Or are we being alarmist in this country when we suggest that there will be a third wave where children will be affected?
Thank you very much, Rajdeep, for having me. I think if you stick to facts and see what is available today, the new variant, the new mutant that we are saying, the Indian mutant, there is exceedingly small evidence to suggest that it is actually causing a lot of infection and serious infection in children. Now, forget data, but if you speak to the pediatric intensivists, I mean, are the intensive care units in India, are the pediatric care units getting filled up? Do we see that scene at all? And I don't think we do. So there is proportionately a higher number of children which will be infected. I don't disagree with that. And when we compare to the US, where you've got more and more of the adult population being vaccinated, proportionately, that younger children are going to be in the limelight, because proportionately they will have higher numbers of infections. But in absolute terms, are we seeing an increase in number of cases in children? And that is the question, because the disease spectrum in children still remains largely asymptomatic or with mild cases, and the mortality is exceedingly small. And that is what the information we've got.
No, the reason I'm asking you this, Dr. Gupta, is that when you look at the United States, where clearly at the moment, 39 lakh infections since the outbreak, 14% of all infections since outbreak, but 48,915 infections from May 6 to 13, that is about 24% of all cases were of children. Brazil is the worst case, where you've got BBC suggesting 2,060 kids under 9 are dead. You've got the United Kingdom, where you are, where 13% infections under 11 are leading to long COVID. So I'm trying to understand from you, are these numbers alarming, or do you believe that at the moment it is premature to suggest that COVID-19 could affect children adversely in the months ahead?
I think it is premature to consider that COVID-19 is going to suddenly explode, and suddenly in the third wave we are going to have well adults, but we are going to have our pediatric intensive care units full of children. I think there is very little data to support that assertion. I think we get confused between proportions and absolute cases. I think the proportion of kids being infected with COVID-19 is high because prevalence is high, and there's no doubt about it. But how many of them are actually ending up in intensive care units, and what is the proportion of them getting so unwell that they die? The rate of death in a 30 to 40 year old in the US is about 45 times higher when compared to a child. So I think what we're looking at is still a milder burden of the disease. And my submission is this: we are at the peak of our number of cases. We're getting nearly 4 lakhs just a few weeks ago. Even in that peak, with that prevalence, were we seeing our pediatric care units being overwhelmed?
Let me take that. I think you raise a valid point. So let's see on the ground what's happening. Dr. Rahul Nagpal, Director Pediatrics at Fortis, are you seeing any increase in the number of children who are being admitted with COVID-19 symptoms?
See, as compared to the first wave, in the second wave, definitely there are, in absolute numbers, more cases which we see in pediatrics. But as Dr. Amit Gupta says, we have not seen an increased percentage of serious cases as of now. We are seeing number of admissions going up because the absolute numbers have gone up.
So what kind of cases are you seeing? What kind of cases are you seeing, Dr. Nagpal? Are you saying you are seeing mild cases of children being admitted, but you're not seeing serious cases at all?
No, it is not like that. We are seeing mild cases. Most cases are mild, and for them we are not admitting them. We are doing home consultations or video consultations. We prefer children to be at home.
Okay.
But the serious patients are there, but far and few in between, and especially those who have underlying diseases like congenital heart diseases, or those who are with malignancies, etc. Those are the children which we are seeing who need to be admitted.
Dr. Spurti Arun, are you also concurring with that the cases that you are seeing by and large are mild and can be treated at home when it comes to young children? Because Singapore, on the other hand, has raised the alarm bells by saying we're stopping schools at the moment, which is why there's an element of panic. We've seen the numbers coming in from certain countries, especially in the American continent. Are we seeing anything similar in India?
So Singapore and Taiwan are probably one of the few countries that have really taken good control of the COVID pandemic. Even recently, if you see, I think there's a cluster of about 38 or so cases, which is what caused the Singapore government to just shut down their airport and the schools, etc. And in that cluster, if I'm not wrong, it's about 3 or 4 kids that have been infected. So, and the genotyping is the 617 variant, which is basically what we are seeing in India right now. So the increased surge of COVID cases in India right now are being said because of the B617 variant. So definitely we are seeing kids also infected by this.
You are seeing kids, but are you seeing them with serious symptoms? Are they breathless? Are you seeing them with serious symptoms, or are they all mild symptoms?
So majority of the children are all mild to asymptomatic and can be taken care of at home. Very few get seriously sick. And even in this, we really need to have more genotyping, more testing to see if it is really coming from the 617 variant. So there's a lot of research and studies that need to be done for this.
Okay.
Now, even if you look at Brazil, it's the particular variant that caused a lot of deaths. But what is being said is that it's really access to healthcare, it's access to ICUs, access to oxygen and medications. That is like the biggest cause for these deaths.
Right. Let me for a moment, therefore, then turn to where the alarm was set in this country. Last week, Dr. Devi Shetty, renowned cardiologist who heads now the Karnataka task force looking into the third wave, spoke about children being vulnerable in this third wave. I'm going to get all of you to respond, particularly Dr. Gupta, because you've already joined issue, I believe, with him. Listen in to first what Dr. Shetty told me a few days ago, and then I want you to respond. As of today, we are not in a position to ramp up vaccination overnight. It appears at the moment. So the fear is that the third wave could come, and as you've written, it could affect children and young parents. Are they now a vulnerable group? Do you believe children and young parents are a vulnerable group that needs to be looked at also? Until now, we were largely looking at those who are senior citizens. With the third wave that you believe will come at some stage or the other, do we need to refocus and now look at young parents and children?
Rajdeep, I am not an epidemiologist. I go by what the experts say. Gradually, we have seen number of children falling sick with COVID-19 compared to the first wave and the second wave. It's gradually increasing. And over a period of time, more and more adults will be vaccinated or they will be infected. When that happens, the virus has to find a new host which is susceptible. And below 18 years old, they are not vaccinated, they are vulnerable. So we believe they are the vulnerable group. And for this, we need to take action right now, because it is not like managing an adult with COVID problem in the ICU. Managing a kid in the COVID ICU is extremely complex. It is extremely complex because doctors and nurses cannot manage the kid. Either the mother or the father should be there. Now, if mother or the father who has 2 or 3 other children, if you ask them to come to the COVID ICU, if he or she is not vaccinated, it is not ethically right. So we have to vaccinate them. So there are 160 million kids who are less than 12-year-old. That means we need to vaccinate 300 to 400 million people as soon as possible. If you do not do it, we'll have a serious problem. See, we in adult COVID ICU with very few nurses, hardly 3-4 nurses managing 20 patients at night, we somehow managed. But in adult, in the pediatric age group, that is not possible, because mother or father will stay. They will insist on good service to their child. But the moment they demand that kind of a service cannot be given in a skeleton staffed COVID ICU, what we are seeing here. We need to have millions and we need to have lakhs and lakhs of young doctors, young nurses to work. And for that, we have to make the plan right now. We have to give them what they want. We need to get people who are doctors and nurses who are not currently in the hospital. They are sitting at home mugging for the exam. We need to bring them out. So all these things takes time. So we need to start acting on it now.
Dr. Gupta, do you believe that Dr. Shetty is being alarmist? Is it,
I wouldn't use
or is he just sending you a message that, look, there could be a third wave and children could be vulnerable?
Well, I wouldn't use such strong words as he's being an alarmist, but I think I would say that he's more worried than he should be. So the point is that proportionately today, let's look at the situation today. Any family who's got COVID, are we saying that the children are somehow spared? No. Proportionately, if you look at 25% of the adults being affected, that's the same proportion that the children will be affected. So children are not being isolated or they're not being protected as of today. So if today they are not ending up in ICU, tomorrow the virus is not going to suddenly mutate and look for children as a new host. The virus is already infecting children. And what is happening is that you just have a mild form of the disease. So I don't agree that, in the third wave, when you have fewer cases than today, then the virus is going to suddenly find kids to be more vulnerable. Unless there is a new mutation that we don't know about.
So that's the question. If there is a new mutation, you're saying, then we all bets are off. Then we don't know.
Well, the new mutations so far, whatever mutations have happened, whether it's the Kent variant or the Indian variant or the South African variant, we have to go by what data we have got. Have any of those variants, except the Indian variant that we don't have robust data about, have they disproportionately affected children? No. So let's look at a resource that we've got, which is limited, and we've got to spend this pool of money. And I would be very surprised if anybody would consider this as good use of resources if we start building new pediatric care, intensive care units under the suspicion that the virus might mutate.
Right.
And unlike previous mutations, is now going to hit children more. And now the children, which previously had just mild disease and moderate disease, which did not require hospitalization, are suddenly going to fill up our hospitals. So I'm coming up from the data point of view, but you've got to look at what the situation is today in India today.
I take your point. The question is, of course, young parents is what was suggested by Dr. Shetty, need to get vaccinated because the fear is, will they pass on the virus to their children? Dr. Nagpal, do you also believe that Dr. Shetty is being alarmist when he says prepare for a possible third wave affecting children? I think you're on mute, Dr. Nagpal. Can you hear?
I guess.
Yeah, go ahead.
Sorry.
Yes.
So I think that we should always be well prepared. We do not know how this virus behaves. It is better to be safe than sorry. Preparation is one thing, and we must do that. However, I agree with Dr. Amit. I have not seen any evidence in anywhere in the world where children have been affected by the variants which have happened up to now. So why should it happen now? Well, we can only speculate.
No, so then why Dr. Nagpal? So then why Dr. Nagpal is this?
And not be caught up.
So then why Dr. Nagpal is this pressure on a number of pharma companies come up with a vaccine now for children? You've got Covaxin, which is beginning trials this week for vaccines for children. It's already, Pfizer is already doing the same. Clearly, there is a concern that at some stage, children will also need to be vaccinated.
Yes, there is a concern, and this is the right concern. The fact is that if we have to get over this pandemic, we need to vaccinate children. Otherwise, this circulating virus is going to infect children somehow, and they are always going to be the reservoirs of infection.
Right.
That is one. And obviously, we need to protect as much as we can. So if we have to get over the pandemic, we must vaccinate our children. And that is where it is necessary.
But they're not the priority group. Am I correct? They're not the priority group in vaccination. In vaccination, priority groups remain senior citizens, remain young adults.
Yes, that is anywhere and everywhere in the world.
Okay.
We must give priority to the elderly and the vulnerable group, but we must look and work towards getting vaccination in children.
Okay, let me also, before I come there to you, Dr. Spurti, Arun, listening to what Dr. Soumya Swaminathan, World Health Organization chief scientist, told me when I asked her this question. How did WHO see the possibility of children being affected by COVID-19 strains? This is what she said. One of the concerns of a third wave is that it could affect children. We've just heard some doctors suggesting they're worried that children could be affected. Is the WHO worried that this pandemic, which at one time was seen to affect senior citizens, could affect children in the future?
I'm not aware of any data that suggests that any, possible future waves are going to affect children in particular. But one thing is true, that as countries start vaccinating their older people, you can see that older people are being protected and that there are less of infection, less of hospitalization in that age group. And so the age groups that are getting affected is coming down. You see that in Israel, UK, etc., where the elderly really have been completely protected now. So that way you could say relatively that younger people could get infected. Children, we've seen from the beginning that while they can get infected, especially children under 10 are usually asymptomatic, usually not picked up and don't get sick. And it's very rare serious events that we see in children who are infected. The multi-organ inflammatory syndrome, it's a very rare complication. So I think because of the protection that vaccines will give to older, you could see it in younger people.
So I think there's a consensus building up that as of now at least, children are relatively, and we use the word very advisedly, relatively protected. But Dr. Spurti, Arun, what are you recommending to your parents who come with young children who may have developed some kind of COVID-19 symptoms? What is the kind of line of treatment you recommend?
Is this for young parents with COVID infection? I didn't hear you clearly.
Young children. Parents, how do they treat their young children who may have COVID symptoms?
Just like the adults, we do ask them to monitor their symptoms much closely. But most of them, as we've already talked about, are mild or asymptomatic and can very well be taken care of in the home. As long as there are no persistent fevers or it shows us continuous signs of inflammation.
We are having a bit of a problem with your audio. Dr. Nagpal, very quickly, what is the recommendation that you give for parents whose young children may have some kind of COVID symptoms?
So the symptoms are same. We first give them counseling. First thing is that please educate the parents. The parents have also to wear the masks, double masks, while looking after their children. The child has to be observed, and some danger signals are given to the parents that these are the danger signals or the red flags when you have to bring them to the hospital. Otherwise, basically it is observation and control of fever with paracetamol 10 to 15 milligram per kilogram per day. We do not advise antibiotics or drugs like azithromycin, ivermectin, etc. to children.
Therefore,
we
Dr.
only
Gupta,
advise monitoring, paracetamol, and observation.
Dr. Gupta, therefore, in conclusion, is this a storm in a teacup? Do you believe, Doctor, that Arvind Kejriwal has created a storm in a teacup, first of all referring to a Singapore strain and then warning about children?
I'll stick to medicine and stay away from politics, but I do think the worry is overrated. I think the message that I would like to say to parents is don't get worried. That's the main thing. You need to get reassured. If it were that dangerous and that bad, it would have already shown up. And in the future, the number of cases are likely to be lower, the total number of cases, and you're very unlikely to just see a complete turnaround in the events and suddenly have your kids becoming very sick. So the main message I would like to suggest is feel reassured.
Good. I think that's a positive message. We rarely get messages that give us a sense of assurance, because seeing the grief and tragedy all around us in the last few weeks has perhaps left us traumatized, but it's good to hear that doctors do believe that when it comes to young children, they are less likely to get serious COVID-19 symptoms, at least for now. Thank you all very much for joining me here on my top talking point this evening. I want to come from there to our Get Real India story. Every day we go to some corner of the country, particularly to the countryside, to find out what the coronavirus situation is. Today we are turning to Pali, a small district in Rajasthan, around 270 kilometers away from the state capital Jaipur, where the situation is turning from bad to worse. And here too, like we've been consistently saying, the government data of COVID cases and deaths is simply not adding up with the reality on the ground. Here's a report filed by Devankur Wadhwa, Get Real India.
A monster COVID surge and a mounting death toll. Districts across Rajasthan are reeling under the second wave. But how true are the numbers shared by the state government? Pali district on paper has 2,500 active cases. But the truth on the ground is quite different, as an India Today reality check found. There are 3 COVID centres in Pali city, the biggest one being the Bangar Government Hospital. And here, what we saw was unsettling. In just 6 hours, 9 bodies of suspected COVID victims were taken away in ambulances.
क्या नाम था, कितनी उम्र थी? कोविड की वजह से मौत हुई थी?
कोविड की वजह से मौत हुई। परमानंद ठाकुर नाम था सर।
क्या उम्र थी इनकी?
इसकी लगभग में 55 वर्ष का था।
The numbers are often higher.
3 गाड़ियाँ लगी हुई है, उन्होंने 3-4 बॉडी छोड़ के आए अभी
10 से 12 बॉडीज रोज की यहाँ से इसी एक अस्पताल से जा रही हैं।
हाँ सर, अलग अलग ड्राइवर लेके जाते हैं, 3 ड्राइवर कंट्रोल रूम से वो आती है, एसडीएम से बस आपको फ़ोन करते हैं और अलग अलग ड्राइवर से कभी 2 लेके जाता है, 3 लेके जाता है।
So clearly this is one particular hospital of Pali district, the government hospital, which has the biggest COVID center, the biggest COVID hospital in the entire district. And from this particular hospital itself, there have been 10 to 12 bodies on a daily basis of patients who were admitted at this hospital, which have been taken out. But the government figures, as far as the COVID patients are concerned, are far less. So what is the reality and where does the truth lie is something which the government should clarify.
What's shocking is many of these deaths are not attributed to COVID. The district authorities claim many patients who test negative for the virus suffer lung damage similar to COVID.
हमारे यहाँ बांगड़ हॉस्पिटल के अंदर भी आज भी अगर हम देखते हैं तो लगभग 50% तो रेशियो ऐसा रहता ही है जो कोविड पॉजिटिव नहीं है, लेकिन उनका HRCT स्कोर ज़्यादा है। हम उसको ट्रीटमेंट कोविड का दे रहे होते हैं, परंतु यदि अनफॉर्चुनेटली अगर किसी केस के अंदर डेथ होता है तो हम उसको कोविड पॉजिटिव डेथ के अंदर नहीं मानते।
Crematoriums are bearing the brunt of the sudden surge in deaths. Pali's Sri Hindu Seva Mandal crematorium, the only gas crematorium for COVID bodies, has been shut for days after it developed a snag following overuse.
8-10 बॉडी रोज के आ रही है, 5-6 बॉडी कोविड आ जाती है। सुबह 8 बजे से गैस प्लांट चालू हो जाता है, रात को 8-9 बजे तक, तो थोड़ी प्रॉब्लम तो होती है।
Dead bodies that had been arriving out here had increased from 2 to 3 to around 10 to 12 patients' dead bodies on a daily basis. The load has increased so much that the gas crematorium had to be shut down temporarily because it developed some snags because of the increased death toll of COVID patients. And somehow it seems that on the ground, the figures presented by the Rajasthan government as far as the death toll is concerned is not in sync with the real situation. With Nikhil Sharma and Bharat Bhushan, Devankur Wadhawan in Pali, India Today.
As I said, across the countryside, clearly deaths are not being reported accurately, and that is the concern going ahead. Let's take a break. When we return,